I'm Dr. Jim Nairus. I'm part of Longwood Orthopedic Associates. I'm an orthopedic surgeon affiliated with New England Baptist Hospital. I do mostly total knee and total hip replacements. Yeah, I look at a lot of patients' previous medical records. I do a lot of what are called independent medical exams, where you're looking at patients' medical records and determining what of other patients, of other medical providers, and you're trying to determine their treatment plan, their disability, or whatever. And so I see a lot of what people use for their EMR systems, and I think definitely a lot of people that use the templated versions of the EMRs where you just click on certain things, they're very impersonal notes. It's really hard to figure out from the physician what they're trying to say, what their plan is. A lot of the notes are carried over, a lot of the sections of the notes are carried over from previous sections, so a lot of the successive notes say the same thing on each successive one, whereas with Dragon you can actually dictate a personalized section to each one of the EMR sections, and I think that's especially helpful in the the history of present illness section, and especially your treatment plan assessment, treatment plan at the end of each individual patient encounter. She is a 61-year-old female who comes in complaining of left hip pain for 6 months, period. There is no history of trauma, period. The pain is in her groin, period. She has tried several conservative treatments, including physical therapy and anti-inflammatory medications, period. The pain is worse with weight bearing, period. It does not wake her up at night, period. She has been diagnosed with bursitis in the past, period. She had a steroid injection for that, which only helped the symptoms on the lateral aspect of her hip, period. She continues to have groin pain, period. Well, I don't think any physician, at least that I've talked to, has been thrilled about having to switch to EHR. It creates more work for us. Just the amount of computer work that you have to do in comparison to the way we used to do it, where we would just have to dictate a note to a transcriptionist, which was very personable. Says the way you want to say things, isn't in template form. But going to the EHR system, which we have to do essentially, you have to come up with a system to, I hate to say it this way, but limit the pain.